Right. Good afternoon. Thank you for joining us. My name is Eliza Marquez. I am the HR Director for Open Skies Healthcare, and with me I have Jerry Mustaine, who is our Treatment Foster Care Program Supervisor, and we're very glad to have you with us today. Joining us, we also have an interpreter who is with us. You have the ability to ask questions. Please use the Q&A feature located at the bottom of the screen, and we will address all questions at the end of the presentation. Thank you. Open Skies Healthcare is located in central New Mexico. We have offices in different parts of New Mexico. We're located in Albuquerque, Grants, Rio Rancho, and Los Lunas. And we are dedicated to bring education about mental illness and substance abuse disorders and treatment to those affected at the local level. Our mission as a nonprofit is to provide exceptional behavioral health care services that empower individuals and families to realize that well-being, recovery, resiliency, and independence are possible. And so what I'll do is I'll go over the different positions that we have available at Open Skies Healthcare. I'll start with our most entry-level position. It is called mental health worker. This position is part-time. The hours are in the afternoon, and the staff work with children between the ages of 3 and 17, and they work on teaching the children social skills and different types of skills to help them, whether it's in school setting or in public setting. And to qualify for that position, you must be 18 years of older, be able to pass a criminal background check, other background checks, and have reliable transportation. Other positions that we have are the behavioral management specialist. That position can be either part-time or full-time, depending on what the employee is looking for. That position can work morning or afternoon hours. This position works with elementary or middle school age children to help them maintain behaviors to be able to function in a community setting. To qualify for this position, you must be 21 years old, minimum of a high school diploma, have a valid New Mexico driver's license, and have the ability to maintain positive relationships with clients and colleagues. Moving on to another position, it is called a community support worker. This position is a full-time position, and this position can either work day or evening hours. The community support worker delivers comprehensive community support services to our clients, and we focus on recovery and resiliency. And to qualify for this position, you must have a bachelor's degree in the human service field, along with 1 year with the target population, or an associate's degree and a minimum of 2 years with the behavioral health population, or a high school diploma with a minimum of 3 years experience, or a high school diploma and a certificate as a certified peer specialist. Our other position we have is a therapist position. The therapist position can be completed, the work can be completed in person or virtually or remote. The therapist position is either full-time or part-time. You can work day or evenings. And the therapist provides individual family or psychotherapy to clients as designed in the treatment plan. To qualify for a therapist position, you must have your counseling license. So, there's different types of counseling licenses, such as a mental health counselor or a social worker. And the last position that I have is a clinical supervisor. This is a full-time position. This position supervises the clinical side of the house, giving supervision to therapists and to any of the staff who are providing clinical services to the clients. It's a full-time position, and the requirements for that job are to have your licensed independent practitioner license and a minimum of 2 years experience working in the field and at least 1 year experience supervising. The full-time positions that we went over are benefit eligible. We offer medical, dental, vision, and a retirement package. On this slide here, it has our contact information. So there I am listed as the HR director with my email address, my office number, our web address, which is, openskieshealthcare.org. And then now I'm going to turn it over to Jerry, who is going to talk to us about our treatment foster care program and the need that we have for foster parents. Thank you.
Thank you, Eliza. And that was really informative. I really appreciate the information that you provided. So today I wanted to talk a little bit about treatment foster care and becoming a treatment foster parent. Our treatment foster parents are really integral to our teams. In order for us to provide the kinds of treatment that our kiddos need, we desperately need to have parents who are completely committed to helping these kids. Treatment foster care focuses on children and youth who are with serious emotional, behavioral, or mental health issues. And those kiddos would be staying with you in your home. Foster parents are an integral part of our treatment team. They provide safe, loving homes and environments where children can learn and heal, and they can learn to do that in a family environment as opposed to a more clinical environment. So you might be asking, well, who can become a foster treatment care parent? Sorry about that. Really, what we really need is for people who really care. We need you to be someone who cares about children and who wants to make a difference in a child's life. We are recruiting folks who are over the age of 25. Single parents are welcome to apply, as well as two-parent households. Families, whether you have children or not, you could still apply. Whether you have biological or adopted children, you could still apply to be a treatment foster parent as well. We are actually really looking for families from diverse backgrounds. Specifically, we're looking for families that might be LGBTQIA or allied with that group, that culture and population. We're looking for parents from diverse religious backgrounds and cultural backgrounds. We are looking for Native families as well, families that would be able to open up tribal homes so that children would be able to be still part of that community as well. And of course, other different diverse backgrounds as well. Parents who are willing and able to pass a background check and complete training are eligible. So the next thing you might be asking is, well, that's great, but what would I do as a foster treatment parent? First and most importantly, you would love and help a child in the most difficult time in their life. You would provide 24/7 supervision for those kids. And in doing so, you would create a safe, stable, structured home environment where they can grow and develop and heal from past trauma. Also, you would have the support of professionals 24/7. There's a team always on call and available to our treatment foster parents 24 hours a day, 7 days a week, 365 days a year. You can get in touch with their treatment coordinator, with a licensed therapist, if that's what's needed, or a supervisor to make sure that the foster parent has all the support in the community that they need. So the next thing is, what would you get from working with Open Skies Healthcare? Our parents receive lots of training and support from our team of caring mental health professionals. You do get to work from home. In fact, you'd be a full-time parent, sort of a professional parent, which is, for a lot of people, that's a really great opportunity. And while you're doing that, you get to make the difference in the life of a child. All of our parents do receive a tax-exempt stipend to help care for the children and youth in treatment. And last but not least, you get to be part of an incredible journey with a child. You just might be that one person, that person who makes all of the difference in the world to a child in need. It's really an opportunity for anyone who is feeling that need to reach out and help children to do that. This is the opportunity to do that. And we will look forward to talking with you. Thank you for your time today and for attending. We'd very much like to answer any of your questions that you have now, if there's any that have come through.
Thank you, Jerry, and thank you, Eliza, for coming in and partnering with us. And thank you everybody for joining. The first question that we have is, do you match ethnicities? For example, Native American child within an African American family?
We do not specifically match ethnicities, child to the foster parent home. However, we do want to make sure that our foster parent that would be taking on a child of a different ethnic background has a cultural understanding of that ethnicity so that they would be able to provide loving, supportive care that's sensitive to the cultural needs of a child from whatever background.
Thank you.
Thank you, everyone. If there's any additional questions, please use the contact information. Contact us with any sort of phone calls, emails. Right now, the behavioral health field is one that definitely is looking for workers, whether it be the entry level or if you are specialized, licensed, or the treatment foster parent position. As Jerry mentioned, that is a position that definitely needs to be filled. We got little kiddos that all they're looking for is a safe environment to start healing. So we do thank you for your time, for joining us, and we look forward to any sort of communication from you in the future. Thank you.
Thank you very much.
I'm sorry, one more question.
Sure, of course.
Is there a cultural sensitivity training for such an example?
We do provide cultural sensitivity training as a regular part of our treatment foster parent, our treatment foster parent training. And then we also provide, and that's the initial training, but then we also provide ongoing training for lots of different types of communities. We are and reaching out to lots of different communities within Albuquerque and New Mexico so that we make sure that we have folks who are coming in to provide the training as well, so that you might receive training from the Native American Training Institute or from the Transgendered Resource Center. So there's we bring in a variety of trainers to make sure that you have exposure to the different cultural backgrounds of kiddos that you might be serving. And I'll be happy to answer any other questions. If we don't get to a question today, please feel free to contact us, and we'll be happy to talk to you about any of the questions that you might have. If you have specific questions about treatment foster care, Eliza, well, she turned it over to me, but she knows all about treatment foster care as well. So either one of us will be very happy to talk to you about becoming a treatment foster parent.
And if we have any questions about the clinical supervisor or those positions, we can go to email you or online, or what is
that? That is correct. You can go to our web address or you can email me directly.
Okay, and are those positions, are you able to train from home, or do you have to train in an office, or?
At this time, it's completely flexible.
Okay. And the next question is, what do parents say they like about being a foster parent?
Sure, yeah. So our treatment foster parent, the thing that I hear over and over again is that they feel like they've really made a connection with those kids. And every one of them has a story about a child that came into their care, who, when they left, they still maintained that connection. We have treatment foster parents who the kiddos who may have been out of their care for a significant period of time. They're in college or even beyond, and they'll still reach out to them on holidays, Thanksgiving, because they've made that lifelong connection and they know that they made a difference in the life of that child.
The questions are coming.
Yeah, absolutely. Is TFC different than state foster care? It absolutely is. Treatment foster care, some of the kids that are in treatment foster care are in the state custody as well, but they don't have to be. These may be kiddos that are stepping down from a higher level of care. Maybe they've been admitted into a hospital for behavioral or mental health issues, or they have been in a residential treatment facility. And so they're stepping down. They want to get back into the community. They may be a private placement, but they're still stepping into foster care because they're not quite ready to go back home with their families. Maybe their families need more training. Maybe they need more help in healing from the trauma. The other way that it goes is that it can be the first step. If a child is having problems that a parent can't handle in the community, despite all of the other supports that Open Skies might offer, they may step into treatment foster care as a way to avoid perhaps a more restrictive environment like a residential treatment center or a hospital. So it is absolutely different. But some of the kids might also be in CYFD custody.
Thank you, Jerry. And the question I have again, another question, how do you decide what children go with a family?
Well, we actually do a comprehensive match assessment. When a child is going to be coming into care, we do a comprehensive match assessment based on collateral information that may be coming from other professionals outside of our agency, and information, particularly if they're with CYFD, we might get information from them, but also interviews with their biological family if they're coming in as a private placement and not part of CYFD. Part of that match assessment looks at the needs of the child, and then also the different skills that a foster parent might have that they would be able to specifically work with a particular problem that a kiddo might have. And it may be areas like maybe they're really good at working with younger children, or children that have other special healthcare needs, or children who are older, teenagers, teenage boys. We have families that work specifically with different age groups, with different types of behavioral issues, just depending on what kinds of issues they might have and what kinds of skills the parent might be bringing into the situation.
If I may add to that, Jerry.
Sure, of course.
When a child is presented to us, whether it be from the state or a private placement, like you said, or a hospital, we do get, it's called collateral, and it's a packet of 7 to 10 pages of this child's life. The foster parent reads this packet so they can see what this child has been through from the first 8 stages of documentation to where they're at currently. And if anyone's ever read collateral, it's pretty heartbreaking, what the child has been through. And so that's why the need for foster parents is, that big right now. The salary for a treatment foster parent, it pays pretty well to be a foster parent. Number one, it's tax-free. And it varies by child. So I couldn't give like a definitive answer to what the salary is, but it is a worthwhile, salary to maintain a household.
And some people do this as their living. That's how they make their living, is being a professional foster parent. Do you need experience? Do you need experience to become a treatment foster parent? What you really need is compassion and love. We'll train you. We'll teach you how to handle the situations that may arise. We'll teach you about child development. So as far as experience being a foster parent, no, you don't. What you really need is just love and compassion for these kids and to want to make a difference in these kids' lives.
Thank you for the great questions. And if there's additional questions, we're always available via email, phone call. We look forward to meeting you, hopefully, whether by email or phone call. If you know of anyone who wants to take in a child, and provide a healing, safe environment, please send them our way. The need for foster parents is great right now.
It really is. And I want to also thank you for your great questions. It's been a great opportunity to talk with you. And I want to just, support what Eliza said. Absolutely. If you don't think you're ready right now to be a treatment foster parent, perhaps you know somebody who is. And we would love to speak to you about this position or any of the other positions that Eliza mentioned. And Open Skies is a great welcoming family. And we do look forward to hearing from you.
Thank you.
Thank you. Thank you, everybody, for joining us.